Good afternoon, everybody, and it's a real privilege for me to be contributing to your conference and to be able to share some thoughts with you regarding your wonderful country and the people who live in it. What a privilege it is for me to share this experience with you. I have a fairly long career in social care and health in England. And the UK to a degree. I have national and local experience and started off as a social work practitioner and was my early experience of integration was as a senior social worker in a community mental health team. I had a long shaggy beard and open-toed sandals and had a small car and worked hard. I have also then progressed to being a director of social services in Nottingham and Nottinghamshire. And around that time, I did a master's research degree on integrating health and social care, which taught me a lot about what had worked internationally as well as locally and introduced me to that side of things. I also was appointed as the chair of the Nottingham and Nottinghamshire integrated care system, which I did for 5 years, and had some help in that time from Oriel, who you all know very well. And I now chair the Mental Health Partnership Board in Nottingham, Nottinghamshire, which has had some struggles of late. So I started that last year. So a wide range of local experience, but I've also had quite a bit of national experience in the UK, or as an independent chair on integrated care for systems up and down the country. I'm currently a member of the expert panel of the UK Parliament's Health and Social Care Select Committee, and contribute in a number of other ways to policy and thinking in the UK around social care, health and integrated care. So that's me. So I think the first one is for leaders to lead a process of deciding what outcomes you want to change for the population. So leaders from across the different organisations deciding on what needs to be changed, but including the workforce and the people who use services, the population, in that discussion. I think the evidence suggests that where people haven't given enough time to sharing that understanding about what are the key priorities to change and how then you can set about it, that's where things have not gone so well. Where those things have happened, it's made a lot of difference. So if I give you an example from my most recent experiences, one national and one local. I did chair the UK government's social care task force for COVID-19 5 years ago now, and which lasted for a year. And part of my role was to bring forward all the national organisations across health and social care to determine what the issues were in social care in response to COVID and what could be done collectively about it. So all of that involved understanding the analysis of the data and the information, understanding what was going well and what wasn't, and what government and those organisations needed to do to keep people safe and help the population of people who have social care in our country to get through that very difficult period. More recently, I have been chairing the Mental Health Partnership Board in Nottinghamshire of all the various organisations, including the police, housing, social care, NHS, various health service bodies, in a situation where things have not gone well in Nottinghamshire. There's been some very unfortunate attacks and murders, so it's a very serious situation. But we have spent a number of months, me interviewing all the 28 people on the board and understanding what they thought were the barriers, what were their ambitions, and we have come up with 3 priorities for 25-26, which are improving local mental health service, community mental health service provision, housing and mental health, and co-production, the extent to which the population is involved strongly in the review of services and their development at an individual level, for cohorts of people, for groups of people with particular needs, as well as at a strategic level. And I have insisted that 2 people with lived experience are on the Mental Health Partnership Board. And so that is part of that. So that's about determining outcomes. My second point is to use the evidence that you have about what the needs are so that you can focus your attention on things that are most important. It is very easy to boil, what we say is boil the ocean, or in your case, boil the Mediterranean, I suppose. But that can be too much. And so understanding what the evidence is about what needs to be done and galvanizing people around that evidence. Where you want to create something new and the evidence doesn't exist, of course, build in the evidence collection so that whatever you start on, you can adjust, or we can adjust as we go along. And then thirdly, join up the infrastructure to make it happen. So obviously it needs the capacity, the budget, the skills of the workforce, and so on, to make these changes happen and to take people with us. And sometimes people start the other way around. They start with the budget, they start with the infrastructure, but they haven't actually decided what it is they want to do. And that's where it goes wrong. So deciding, putting all those steps in that order seem to me to be very important. And linked to that, we need to understand what the enablers are, what the levers are to make change happen. And in that regard, we have to make sure that the capacity, the policies of the local government structures, be that local government or central government, are in the right place to create the conditions in which people can succeed. So our laws and our policies are often built up separately with different focuses for different organisations. And so policymakers and strategic leaders have a role to make the job easy for local people to succeed, as opposed to putting barriers in their way. So those are my 3 main points, Oriel. I think it's helpful, providing everybody has decided what it is that they want to do, and that they so that follows first before deciding what the budgets are. And there is a continuum that I have lived through, whereby the first thing is for people to understand their budgets. And it's amazing how across different organizations, in my experience, people don't. They know what their constraints and requirements of their budgets are, but they don't tend to know necessarily what close partners are. And in the UK context, often health leaders, the rules around budgets for health services are very different from local government. And often people do not understand that and what the differences are and what the constraints are, because we don't understand the constraints and barriers, we can't overcome them. So I think it's important, providing that's clear what we're trying to do. The second thing that's important is to understand precisely what it is to be invested in, and what will happen if some risks occur. So sometimes people enter into an agreement to share a budget, and then one partner has financial challenges and will want to pull the plug and pull the money back. So what happens around risk sharing and investments to make sure that we understand that? And when I did my master's research degree, I went to some different parts of the country where some things where that had gone very well, and others where it had gone badly. And it was lack of attention to that detail about what's to be invested in, who benefits from the outcome, if there are any savings, or where do they go, how are they used, and if there are risks, how are they going to be handled by the various parties? How is risk sharing going to take place? So those are very important. I wouldn't rush to a joint budget until those things are in place, but you can make a start. In other words, if you understand the alignment of budgets and how things are going to be funded, you can make a start and then adjust it proportionately depending on what the size and scale of the partnership is. Well, first of all, make sure there is some governance. Make it proportionate and clear. In other words, if you are so in some cases that I've been involved, situations I've been involved with, there are fully integrated budgets, governance arrangements which involve joint committees and boards involving politicians and officers. In other cases, for example, the Mental Health Partnership Board I'm chairing, there are no set budgets over which is overseeing. There are some performance issues which it is overseeing. But clearly, if you are overseeing a budget, the proportionality, the scale of it needs to be more go up. So I think that's the first thing. Decide once we've decided what it is we're trying to change and what we're trying to manage, then it's much easier to think about the structures that are best placed to do so. But being clear about them seems to me to be terribly important. So clearing about the strategy, the budget, and the performance and the quality. These are the four things that seem to me to be crucial in determining what makes a good service and a good organisation. There are other things. Obviously, we've got to work with the workforce, but if those 3-4 things are attended to, then that's quite important. My second bit of advice is don't spend years sorting this out. Make a start and build the structures accordingly. Because sometimes people can spend a lot of time, a couple of years, sorting out the structures, and then they actually haven't changed anything for the citizens, which is what we all want to do and what we're here for. And my final point is, these days I act as an independent chair. There are pluses and minuses of having an independent chair as opposed to somebody who's drawn from the system, whether it be a politician or an officer or what have you. But I think in some cases there is an advantage in having an independent chair, because often what we're trying to do is navigate and broker the challenges and differences between people to keep people focused on the joint endeavour. So I would give that some consideration. So those are my thoughts about governance, Oriel. Well, I do hope that your conference is successful, and I know something about the fantastic work that's taking place in Spain. It's been a real pleasure to be able to share these thoughts with you, and I wish you all the very best in the future.